we have really serious problems that national food policy could address. The food system currently is a set of disparate jurisdictions, a set of different actors. They do interact with one another, but often with very little coherence, often in a competitive way. And the system could be far more efficient and produce better outcomes for the public if we actually came up with a strategy that coordinated what everyone is trying to accomplish. Well, the obesity epidemic is probably one of the best examples for why you need to work with a systems-based approach. And the leading researchers who actually already are informing government, say at the Centers for Disease Control or the National Institutes of Health, Institute of Medicine, take very much a systems-based approach. And the reason for that is that obesity is one of these conditions that has no single cause. There are a number of distal causes, intermediate causes, proximal causes. They have to do with such disparate things as the physical environment, marketing to children, the food environment in schools, whether you have physical environments in neighborhoods that are conducive to physical activity, the economic status of families and their actual access to food, the quality of food itself, its nutrient density. There are so many factors that actually all add up to this condition that creeps up on all of us without us being aware of it, that a systems approach that addresses each one of those components and makes them healthy, so that then the total system by default is the healthy environment and none of us has to think about it. That is all a systems way of thinking, and there's a role for almost every agency in the U.S. government to play in creating such a more healthful, anti-obesogenic environment. The pragmatic fact is that any perceived threat to an agency's budget and purview is going to be met with resistance. But if this can be presented as a way that they can all be more successful in meeting what they're created to do, I think that way there might be some greater receptivity. The national epidemic of chronic disease is a huge burden on the federal budget. So if that were given as a problem to solve to this kind of interagency task force, that might be a way of making their task much more concrete. So I think a national food policy could address this because we could frame it in a way that would be beneficial for public interest, that would be beneficial for stakeholders, that would be beneficial for the government administrators. We could make a case for a national food policy that is fiscally responsible because of the fact that we could streamline operations, reduce the cost and the size of government. So I think it could be effective in a cross-partisan way if we can demonstrate that a smaller government can deliver better. I think for this idea of a national food strategy to be viable, it needs to be instituted in a way that everybody can see how they can be a part of it and how they can benefit from it, particularly at the level of agencies and the regulatory level. So that means that agency heads should participate themselves or send delegates. It should at least be a deliberative body that has an interagency flavor and provides the opportunity for coordination and sharing of information about what the different agencies are doing. And I think that if that is done consistently over a period of time, and the program is operated with good faith and it isn't a threat to the budget lines or the missions of these agencies, in the course of that interaction they'll discover how working together they can actually produce better outcomes. So at the outset I think that would be the better way of doing things than, for instance, naming somebody that would have authority over all of these agencies and would be more directive. That would immediately set up adversarial relationships or resistance. And so even though that's a model that could be explored, I think that collaborative, deliberative way of operating might be the best way of beginning. Stakeholders are very important because of the fact that they're the ultimate constituency that validates whether an agency is effective or not. Yeah, I think stakeholders are vital to define the way in which a national food policy could be more effective, because that's actually where they understand how government programs impact them, whether favorably or not. And wherever you have that experience, you just naturally think of what would be better. So when you're looking for what would improve on the way in which government currently functions, you have to go to the people that are the recipients or the participants in actual programs and solicit their ideas. There's already models for how that might work. The the burden to the federal government of the three major killers of Americans that are related to the way in which we eat, which are obesity, diabetes, and a series of cardiac diseases, approximates about $1 trillion. It's about $935 billion a year. On an annual basis, we spend about $100 billion a year in 18 different food assistance programs. These two things are related, but we don't treat them as if they were related. So better investments that were targeted toward preventive programs and how we deal with our food assistance programs could have a chance to significantly reduce the financial burden of disease that the federal government also has to deal with at the opposite end of the food system. So there is an example of how a national food strategy could really help everybody in the nation, eaters as well as the efficiency of government, stakeholders as well as program administrators.